Top 25 Medical Technologist Interview Questions and Answers. In the competitive field of medical technology, preparation for interviews is essential. This video will highlight the top 25 interview questions that candidates may encounter, along with effective strategies for answering them. By understanding these questions and their context, aspiring medical technologists can enhance their confidence and presentation skills. Join us as we explore key insights and tips to help you succeed in your upcoming interviews. 1. What are the main responsibilities of a medical technologist in a clinical laboratory? Medical technologists play a crucial role in the clinical laboratory by performing complex analyses on patient samples. They are responsible for preparing specimens, conducting tests, and accurately interpreting results. Their duties also include maintaining laboratory equipment, ensuring quality control, and following safety protocols. Additionally, they must keep detailed records of test results and communicate findings to physicians. Continuous education and staying updated with advancements in laboratory techniques are also part of their responsibilities to ensure optimal patient care. 2. Can you explain the difference between qualitative and quantitative testing? Provide examples. Qualitative testing determines the presence or absence of a substance, providing a yes/no result. For example, a pregnancy test checks for the human chorionic gonadotropin, HCG, hormone. A positive result indicates pregnancy, while a negative result indicates otherwise. In contrast, quantitative testing measures the exact amount of a substance within a sample. An example is a blood glucose test that provides a specific concentration of glucose in milligrams per deciliter, milligram per deciliter. This distinction is crucial for diagnosis and treatment decisions in clinical settings. 3. How do you perform and interpret a CBC, complete blood count, test? To perform a CBC, first collect a blood sample in an EDTA tube to prevent coagulation. After mixing the sample, analyze it using an automated hematology analyzer, which measures various parameters such as red blood cell count, white blood cell count, hemoglobin, hematocrit, and platelet count. Interpretation involves assessing these values against normal reference ranges. Abnormal results may indicate conditions such as anemia, infection, or blood disorders. It is essential to consider patient history and clinical context when making interpretations, ensuring accurate diagnoses and treatment recommendations. 4. What steps do you take to ensure accuracy and precision in lab results? Ensuring accuracy and precision in lab results involves several critical steps. First, I adhere strictly to standard operating procedures, SOPs, for all tests performed. This includes proper calibration and maintenance of equipment, ensuring reagents are not expired, and following correct sample handling protocols. I regularly participate in quality control, QC, checks and proficiency testing to validate test performance. Additionally, I document every step meticulously and collaborate with team members for double-checking results when necessary. Continuous education on best practices in laboratory techniques also plays a vital role in maintaining high standards. 5. Describe your experience with automated analyzers, for example, hematology, chemistry, or microbiology analyzers. I have extensive experience working with automated analyzers in hematology and chemistry. In hematology, I regularly operate analyzers that perform CBCs, ensuring accurate cell counts and indices. I am skilled in troubleshooting common issues, such as instrument calibration and maintenance. In chemistry, I utilize analyzers for serum tests, carefully monitoring quality control measures. My familiarity with microbiology analyzers includes processing cultures and interpreting results. This experience has enhanced my ability to deliver timely and accurate lab results, supporting effective patient care. 6. How do you handle and process microbiology cultures? Handling and processing microbiology cultures involves several critical steps. First, samples must be collected using sterile techniques to prevent contamination. Once collected, they are inoculated onto appropriate culture media, which supports the growth of specific microorganisms. Incubation conditions, such as temperature and atmosphere, are then carefully controlled to optimize growth. Regular monitoring is essential to check for signs of growth, and colonies must be correctly identified using various biochemical tests. Finally, results are documented meticulously, and any pathogens are communicated to the healthcare team promptly to ensure effective patient management. 7. What are some common sources of error in laboratory testing, and how do you prevent them? Common sources of error in laboratory testing include sample contamination, improper handling, and equipment calibration issues. To prevent contamination, strict aseptic techniques must be followed during sample collection and processing. Proper training ensures that all staff understand the importance of handling specimens correctly. Regular maintenance and calibration of laboratory equipment help maintain accuracy. Additionally, implementing quality control measures, such as running control samples alongside patient tests, allows for immediate detection of discrepancies, ensuring reliable results. 8. Explain the principle behind ELISA, enzyme-linked immunosorbent assay, testing. ELISA is a plate-based assay technique used for detecting and quantifying proteins, hormones, antibodies, or antigens in a sample. The principle involves immobilizing the target molecule on a microplate and introducing a specific antibody linked to an enzyme. After binding, a substrate is added, which the enzyme converts into a detectable signal, usually a color change. The intensity of the signal correlates with the concentration of the target in the sample. This method is highly sensitive and specific, making it widely used in diagnostics and research applications. 9. How do you validate new laboratory equipment or testing methods? Validating new laboratory equipment or testing methods involves several critical steps. Initially, I ensure that the equipment meets the manufacturer's specifications. Next, I conduct performance checks, which include testing precision, accuracy, and linearity using control samples. Comparison with established methods is essential to confirm results are consistent. Additionally, I document all findings meticulously and provide training to staff on the new equipment or method. Finally, I establish a maintenance schedule and periodic re-evaluations to ensure continued compliance and functionality. 10. What safety protocols do you follow when handling biohazardous materials? When handling biohazardous materials, I adhere to strict safety protocols to ensure my safety and the safety of others. This includes wearing appropriate personal protective equipment, PPE, such as gloves, lab coats, and face shields. I always work within a biosafety cabinet when dealing with potentially infectious samples. Proper waste disposal procedures are essential. Biohazardous waste is segregated and disposed of in designated containers. Regular training on handling procedures, emergency response, and spill management is crucial. Following these protocols minimizes risk and maintains a safe laboratory environment. 11. A patient's test result is critical, for example, extremely high glucose or low hemoglobin. What steps do you take? When I receive a critical test result, my first step is to verify the accuracy by double-checking the result and ensuring the proper protocols were followed during testing. Next, I promptly notify the appropriate healthcare provider, providing them with all relevant information about the test and patient history. I ensure that the communication is clear and documented in the system. After that, I monitor the situation closely, ready to assist with any follow-up tests or interventions the medical team may require to address the patient's condition effectively. Prompt action is essential. 12. If you encounter an inconsistent or questionable test result, how do you troubleshoot it? When encountering an inconsistent or questionable test result, I first verify the test parameters and ensure all calibration and quality control measures were properly conducted. I then review the sample collection process for potential errors such as improper handling or contamination. Repeating the test with a new sample, if possible, helps confirm the initial result. I also consult with colleagues or reference materials to identify any unusual factors that could have affected the outcome. Documentation of all findings and actions taken is crucial for future reference and quality assurance. 13. How do you prioritize workload when multiple urgent tests come in simultaneously? In situations where multiple stat tests arrive at once, I assess the urgency and clinical significance of each test based on patient needs. I consult with the ordering physician if necessary to clarify priorities. I also consider factors like the type of tests and the potential impact on patient care. Utilizing a systematic approach, I delegate tasks to my team efficiently, ensuring that the most critical samples are processed first. Clear communication with colleagues is vital, as is maintaining a focus on accuracy to prevent errors during this high-pressure period. 14. A coworker makes a mistake in sample labeling. How do you address this situation? When addressing a coworker's mistake in sample labeling, I would first ensure patient safety by locating the mislabeled sample and verifying its contents. It's crucial to communicate with the coworker privately, discussing the error in a non-confrontational manner to understand the circumstances leading to the mistake. I would emphasize the importance of accuracy in labeling and suggest implementing double-check systems or additional training if necessary. Maintaining a supportive environment encourages transparency and helps prevent future errors, fostering a culture of accountability within the team. 15. The lab equipment malfunctions mid-test. What is your immediate action? When lab equipment malfunctions mid-test, my immediate action is to stop the test and alert my supervisor or the designated personnel. I ensure all samples and data are securely saved if possible. Then, I troubleshoot the issue by checking for common problems, such as power supply, error messages, or loose connections. If necessary, I switch to backup equipment to continue testing. I document the malfunction in the lab's incident report and perform any required maintenance or calibration once the issue is resolved. Communication with the team is vital to ensure everyone is aware of the situation. 16. How do you perform and document quality control, QC, in the lab? Quality control, QC, in the lab is performed by conducting regular checks on instruments and reagents to ensure accurate test results. I start by running control samples alongside patient specimens, comparing results to establish ranges. I maintain a QC log that includes date, control lot number, test results, and any corrective actions taken. Trends in QC data are analyzed to identify potential issues. Regular maintenance and calibration of equipment are also documented to ensure compliance with standards. This rigorous process helps maintain the reliability of laboratory results. 17. What are CLIA, Clinical Laboratory Improvement Amendments, regulations, and why are they important? CLIA regulations establish quality standards for laboratory testing in the United States. They ensure that laboratories meet specific requirements for accuracy, reliability, and timeliness of test results. These regulations cover all laboratory testing performed on humans, aiming to improve patient safety and care. Compliance with CLIA is essential for laboratories to maintain certification, receive reimbursement from Medicare and Medicaid, and ensure that testing practices adhere to national standards. This helps guarantee that patients receive reliable diagnostic information crucial for effective treatment decisions. 18. How do you ensure compliance with HIPAA and patient confidentiality in the lab? Ensuring compliance with HIPAA and maintaining patient confidentiality involves implementing strict protocols for handling patient information. Staff members undergo training on HIPAA regulations, emphasizing the importance of safeguarding sensitive data. Access to patient records is restricted to authorized personnel only, using secure passwords and encrypted systems. Regular audits are conducted to identify potential vulnerabilities. Additionally, conversations about patient information are held in private areas, and any physical documents are securely stored. These measures help create a culture of confidentiality within the laboratory. 19. Describe your experience with CAP, College of American Pathologists, or other lab accreditation standards. I have actively participated in the accreditation process with CAP, which involved preparing documentation and ensuring compliance with their rigorous standards. This included performing regular internal audits, conducting proficiency testing, and implementing quality control measures to maintain high testing accuracy. I also attended workshops and training sessions provided by CAP to stay informed about updates in laboratory practices. Engaging with CAP has significantly improved our laboratory's operational efficiency and quality of results, fostering a culture of continuous improvement among the team. 20. How do you handle discrepancies in proficiency testing results? When handling discrepancies in proficiency testing results, I first confirm the results by reviewing the testing process and ensuring that all protocols were followed correctly. I investigate possible sources of error, such as reagent issues, equipment calibration, or sample handling. If discrepancies persist, I consult with colleagues or supervisors to gather insights and verify findings. It's crucial to document the process thoroughly and communicate any issues promptly to the relevant stakeholders. If necessary, I may initiate retesting and assess the impact on patient care, ensuring that all corrective actions are taken to prevent future occurrences. 21. Describe a time when you had to work under pressure. How did you handle it? During a particularly busy shift, we experienced a sudden influx of stat samples due to a local health scare. The lab was under significant pressure, with multiple tests needing immediate attention. I prioritized the samples based on urgency and communicated with my team to ensure everyone was aligned. I focused on one test at a time while maintaining quality control measures. By staying organized and calm, I effectively managed my time and ensured all critical results were processed accurately and reported to the healthcare providers without delay. 22. How do you communicate critical lab results to physicians or nurses effectively? Communicating critical lab results requires clarity and urgency. First, I ensure that I have all necessary information and context about the results. I then contact the healthcare provider directly, whether by phone or in person, depending on the urgency. Using clear, concise language, I convey the critical results, emphasizing their significance and any necessary follow-up actions. I also document the communication in the lab system to ensure there is a record. If required, I offer to discuss any questions or further information needed to support patient care effectively. 23. Tell me about a time you identified an error before it affected patient care. What did you do? During my time as a medical technologist, I once noticed an abnormal result on a patient's electrolyte panel that seemed inconsistent with clinical symptoms. Before reporting it, I double-checked the calibration of the analyzer and reviewed the sample handling process. Upon investigation, I discovered that a reagent had not been properly mixed. I promptly informed my supervisor and collaborated with the team to retest the sample, ensuring accurate results were reported. This proactive approach not only maintained patient safety but also reinforced the importance of vigilance and teamwork in the lab. 24. How do you stay updated with advancements in medical laboratory technology? Staying updated with advancements in medical laboratory technology involves a multifaceted approach. I subscribe to reputable journals such as Clinical Laboratory Science and Journal of Clinical Microbiology to read the latest research and reviews. Attending professional conferences and workshops allows for networking and exposure to cutting-edge techniques. I also participate in online courses and webinars that focus on new technologies and methodologies. Additionally, engaging with professional organizations, such as the ASCP or AACC, helps me access resources and guidelines that reflect current best practices in the field. 25. Why did you choose a career as a medical technologist, and what motivates you in this field? I chose a career as a medical technologist because of my passion for science and desire to make a difference in patient care. The opportunity to work with advanced technology and contribute to accurate diagnoses excites me. I am motivated by the prospect of continuous learning and staying updated with innovations in laboratory medicine. Each day presents new challenges, and knowing that my work directly impacts patient outcomes drives my commitment. Collaborating with healthcare professionals to provide essential data reinforces my dedication to this vital field. In this video, we've explored the top 25 medical technologist interview questions and provided insightful answers to help you prepare for your next interview. Whether you're a seasoned professional or just starting in the field, understanding these questions can boost your confidence and performance. We hope you found the information valuable and feel more equipped to tackle your upcoming interviews. If you enjoyed this content, please like the video and subscribe to our channel for more helpful tips and resources. Thank you for watching.